Hello and welcome. It's 11 a.m. here in South Korea. I'm Kim Mo-gyun at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. Now, in just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Lee Ki-il, Deputy Minister for Healthcare Policy at the Ministry of Health and Welfare, will be briefing us on the coronavirus situation here in the country. The briefing will give us an update on the number of new infections as of midnight, as well as any trends and the latest on the vaccine rollout. Also, the latest social distancing measures and efforts that the government is making to contain the virus, which is spreading rapidly lately. To give you a brief idea as we wait, South Korea reported 1,212 new COVID-19 cases on Wednesday, the highest daily infections in 6 months. Now, of Wednesday's new cases, all but 44 were local infections. One additional death has been reported, bringing the death toll to 2,033. And now we will turn to the Sejong Government Complex for a briefing.
We are also joined by Mr. Chung Yeon-gi, and we also have sign language translation available for you. First of all, here is Mr. Lee Ki-il, who will be briefing us on the COVID-19 response measures. Good morning. I am the Deputy Minister for Policy at the Health Ministry, and let us now begin our regular briefing for July 7th, Wednesday. And as of today midnight, we have 1,268 new local infections and 44 new imported cases, adding to a total of 1,212 cases today, which is about 416 more than the previous day. And in the metropolitan area, we are also seeing an increase in the number of daily infections. And also in Seoul, we have 577 cases being reported today, which is one of the largest, highest numbers after the COVID-19 onset of the COVID-19 pandemic. And we see clear signs of the rapid spread of the virus, and we believe that we are at a very critical moment. And centering around those in their age group of 20 and 30, we are seeing increase in the number of infections. However, we are also seeing a decline in the new infections among the age groups above the age of 60. Nevertheless, we are also seeing an increase overall in all age groups. And in particular, we are also seeing cluster infections stemming from multi-use facilities and also the districts age from Gangnam-gu district, Jungnam-gu district, and other areas as well, including Mapobu district. And compared to earlier this month, we are also seeing continued sporadic cluster infections. And for the time being, we are also not seeing any reports of cluster infections stemming from high-risk facilities like nursing homes, nursing hospitals. Rather, we are also seeing cluster infections in the multi-use facilities, including cafes, restaurants, pubs, and academies, and so forth. And we are not seeing the Delta variant being spread as the dominant strain here in South Korea. However, we are also seeing the continued spread of the variant as well. And while we are also seeing a general increase in the number of new infections, our new daily tally for those above the age of 60 remained stagnant, meaning that we are also seeing a no increase in the age group of above 60, and we are also seeing a stabilization of our fatality rate as well, which has decreased significantly. And also, as for our medical response capacity, we have about 74% of our ICU beds available for COVID-19 patients. And as for the hospitals for mild and light symptoms, we also have about 60%, which are available for use. And at life treatment centers, we are also seeing more people being administered there. And to this end, we are also seeing a downsize in the number of available hospital beds. However, we also have about 40% hospital beds available right now. And to this end, we also plan to increase the number of life treatment centers by a total of 8, including 5 in the Seoul city. And to this end, the quarantine authorities today, this morning, we have discussed measures to intensify and bolster quarantine measures in the metropolitan area. The government has has decided to maintain and extend the current social distancing level in the metropolitan area for another week. And if such increases further if the virus spread further continues, we will be elevating the level of social distancing measure. To this end, in Seoul, Gyeonggi-do Province, and Incheon City, we also will be maintaining our level 2 of social distancing measure, and a ban on the gathering of more than 5 people will also be maintained as well. And today, our average daily number of infections in the metropolitan area, we see about 636, which is at the threshold of level 3. And however, on the other hand, we also have other regions which are not subject to these levels going forward. And to this end, in the Seoul metropolitan city government has extended its opinion that it is willing to extend the current level of social distancing of level 2 in the metropolitan area, especially in Seoul City. And we will be also discussing ways to bolster and intensify and also raise these levels going forward if we see the need even further. And the government will also exert our full efforts to bolster our monitoring to also contain the virus here in the metropolitan area. In Seoul and Gyeonggi-do Province, they also have walk-in screening centers at areas that are congested, and they will be increased to a number of 51 in the city of Seoul. And in Seoul's Gangnam-gu district and Hongdae area, we will also advise all of the people, the young people in particular, if you have visited these crowded areas, we ask you to get tested and also stay home and get some good rest. In addition, if you have any clinical symptoms of COVID-19 like fever or other respiratory symptoms, we ask you to also get tested as soon as possible. And in other regions, we will also be conducting our regular PCR testings for those facilities which are deemed vulnerable to the virus spread, and we will also provide pan-government support as well. And we will also intensify the implementation of such quarantine measures, and if there are facilities that have breached the quarantine measures at least for one time, they will also be faced to close their businesses for about 10 days. And we also will set up about 10 task force together with the cooperation of the police agency. And to this end, we will also intensify our quarantine measures going forward. Ladies and gentlemen, we are also seeing the daily hike in the number of infections, and I believe that you are also very much worried about the current spread. Nevertheless, if we join hands, we are confident that we can overcome the spread of the COVID-19. We ask for your continued participation going forward. And in the metropolitan area, which are seeing a high number of infections, we ask you to refrain from having private gatherings and also refrain from moving outdoors as much as possible. And until the situation is stabilized, we also ask you to utilize the work from home scheme. And also in particular for the younger generation in the metropolitan area, especially those between the ages of 20 and 30s, we ask you to refrain from going to crowded areas and get tested as soon as possible. We believe that this is essential to protect the health of yours and also that of your loved ones. And if we all join hands, we are confident that we can contain the virus going forward. And the government will also exert our full efforts that we can return to a state of normalcy as soon as possible. Thank you very much.
Now, that was the government briefing on the COVID-19 situation here in South Korea. The nation reported 1,212 new COVID-19 cases Wednesday. Now, this brings the accumulated number of cases to 162,000. There has been one more death, raising the death toll to 2,033. We'll wrap up our coverage here. We'll be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.